Good morning, everybody. Today is February 3rd, 2020, and this is the Wuhan coronavirus update for the day. As of right now, there are 17,488 cases across the globe. 2,298 of them are listed in critical condition, roughly 13%. As of right now, there are 362 deaths reported, as well as 523 people recovered from the illness. Yesterday, the United States confirmed an additional 3 cases in California, as well as the second instance of person-to-person transmission in a husband and wife couple. New York City also reported that they have 3 possible cases awaiting testing from the Centers of Disease Control. Now, this is something that you'll want to keep an eye on to see if there are any confirmed cases in New York City, especially since it is a metro area, very high population density. So that's something to watch for over the coming days. The New England Journal of Medicine released a dynamics report on the first cases of the virus. They took a look at the initial outbreak and they basically did statistical analysis on it. What they found was there was massive amounts of human-to-human transmission, and they also found that the infection rate had basically doubled every 7.4 days. So the amount of confirmed cases ends up doubling every 7.4. At least that was the case in the early onset of the outbreak. What was concerning to me was the duration from illness to medical attention. So when the onset of the symptoms appeared to the time that they were admitted into the hospital was an average of 5.8 days for the first victims. And then that average fell to around, I believe it was 4.8 or so. You should definitely take a look at this report to get some ideas on how this infection works, how this virus works and moves. But right now, experts warn that there are possibly many more infected with this virus, affected, than they are confirmed. Basically, in China, with a lack of test kits being reported, reports of hospitals turning away people with symptoms because they don't have room, it's very difficult to actually gauge the amount of infections that are currently taking place, as well as the amount of deaths. It's kind of scary to think about how quickly this virus has progressed, and we're nearing now 20,000 infected across the globe. And that brings into question the death rate. As of right now, they are estimating the death rate of this virus is 2%. Now, with the reports of people having this virus and having extremely mild symptoms, I can see how somebody would contract this virus and not seek medical attention and never be confirmed. But this also gives them the ability to spread it around. So as of right now, with a 2% death rate, what it seems is that people are taking the amount of confirmed cases and dividing it by the amount of deaths, which is typically how you figure out a mortality rate. But the problem is this disease isn't over. It's not over at all. Generally, somebody can be ill for a week up to 2 weeks before it becomes fatal to them. So the question therein lies, out of the 2,298 that are listed in critical condition, how many of those people are going to die over the next 2 or so weeks? We'll have to find out. The way that I look at it is, if I'm looking at the amount of infected people, I'm not really concerned with how many of them are infected as opposed to how many of them recover from the disease and how many of them die from the disease. I figured that would be a more accurate mortality rate than the total number of infected, especially when the amount of infected are rising by thousands every day. Those people just became sick, they have not recovered, and there's still a potential that they will pass away due to complications of this illness. So as of right now, there are 362 deaths reported, and there are 523 patients reportedly recovered. That would make the death rate, the mortality rate of this disease, of people who have reportedly lived through it or died through it, at 40%. Now, I don't believe the mortality rate of this virus is 40%. I do believe that it is lower, but it's also complicated in the fact that the confirmed cases are more than likely underestimated due to the lack of test kits, due to the lack of hospitals, due to the lack of serious symptoms in people who are infected. But that also means that the confirmed deaths are most likely underestimated as well. If somebody shows up to a hospital and there is no room for them and they get sent home and they pass away in their home, are they going to be counted as a death towards the coronavirus outbreak? More than likely not. At least that's what I've heard from sources in China. So really, what the thing to take into consideration is the method of transmission. Most scientists right now are still trying to figure out how this virus is transmitted from person to person. They're trying to figure out why it is spreading the way that it is. With asymptomatic instances and reports of people spreading this virus without having any symptoms, the question is, how? How are they spreading it? Asymptomatic means they don't have any symptoms at all. They're not coughing, they're not sneezing, they don't have a fever. Most scientists think that coughing and sneezing is the way that it is being transmitted, but if somebody doesn't have those symptoms, how are they transmitting it? There's two different options, in my opinion. The first is through surface contact. So if somebody who is infected, they're shedding the virus, maybe they touch their nose, maybe they touch their lips, maybe they're talking and a little bit of spit comes out and it lands on the table. Somebody then touches that, touches their eyes, their nose, their mouth, and then becomes infected. That is one way that this is possibly spreading asymptomatically. The second way would be the much scarier way, and that would be airborne. Scientists right now have not confirmed airborne transmission of this virus, but my question is with the rate of this spread, is it a possibility that this thing could be airborne? As you know, when you go outside and it's incredibly cold, probably under 40 degrees, and you exhale, steam comes out of your mouth. That steam is water vapor, water droplets. If this virus has the ability to be carried through that water vapor, then there is a possibility that somebody could be in close proximity to someone, breathe in their water vapor, and then become infected themselves. I pray that this is not the method of transmission that this disease is taking, and it will be a matter of time and more cases before scientists have a real grasp on the seriousness and the transmission of this illness. So really, the thing to consider is taking an abundance of caution. The evidence of non-symptomatic spread in Germany right now is alarming. From one individual, there are now 8 confirmed cases in Germany, all related to the same. With 11 confirmed cases in the United States, the question therein lies, at what point do those individuals get other people sick, possibly somebody who they don't know had close contact with? The next 7 to 10 days in the United States is going to be a time to watch, pay attention, and look to see how this outbreak is progressing. Really, preparation is key. You really need to prepare yourself. If this thing is transmitted through the air, if it is as infectious and contagious as the medical community believes it is, then there is a chance that we could have outbreaks across the United States. As of right now, China has locked down over 60 million people to prevent the transmission, and you really need to think about the repercussions of this disease in your life if it's really as bad as I personally think it is. If this virus has the ability to transmit via the air, then it could be a game changer. Really, the only way to snuff out this virus would be through isolation, self-quarantine, massive quarantine across the United States. If that happens, generally the CDC, the World Health Organization, they will claim that an outbreak has been eradicated when there are 3 incubation periods that go by without a confirmed case. So with this virus, in order for the CDC or the World Health Organization to claim that there was no longer an outbreak in any of these countries, there has to be 45 or so days that go by without an additional case. So that being said, you need to be prepared to isolate yourself for about 2 months. And I would recommend 3 months worth of food, water, and supplies. And the reason why is if it gets bad enough to the point where we need to lock ourselves down and isolate ourselves to prevent the spread in the United States, then you're going to want to have food and water. You're not going to want to have to walk out to the store. You're not going to want to have to expose yourself to the public because somebody who is seemingly healthy could get you sick, and then you could bring that sickness back to your family and give it to your whole family before you even knew you were ill. That is the reality of the situation, and that is what we need to prepare for. I am not necessarily afraid of this virus as much as I am afraid of the social ramifications of people, especially people who are not prepared to live in their house for up to a month and a half. Most people do not have a week's worth of food in their home. And if they are forced to stay in their house and they run out of food, then they are more than likely going to go looking for food. And it's just going to perpetuate the infection, perpetuate the outbreak. The most important thing that you can do is prepare yourself and your family, stock up on non-perishable food, and keep doing research on this outbreak and come up with your own conclusions. That is my report. That is everything that I have seen, and I think everything that is pertinent. I hope it helps.